Good afternoon. This is All India Radio. I am Nishit Kumar and with me is Reshma Tiwari with the Midday News. The headlines. Prime Minister Narendra Modi urges people not to be swayed by rumors about COVID-19 vaccine. Asks them not to forget the mantra of Dawai Bhi, Kadai Bhi. In his Mann Ki Baat program, Prime Minister appeals to states to extend benefit of centre's free vaccine campaign to maximum people. Government fully engaged in taking forward the efforts of state governments against COVID pandemic, says the Prime Minister. Mr. Modi says a positive spirit is imperative to fight corona and the countrymen have to maintain it. Prime Minister lauds the role of nurses, ambulance drivers and other corona warriors in serving the people. 551 oxygen generation plants to be set up in district government hospitals through PM CARES. Over 14 crore 9 lakh COVID-19 vaccine doses administered in the country so far. Delhi government extends lockdown till the 3rd of May amid spike in COVID cases. Centre hikes allocation of remdesivir injections to states. Mahavir Jayanti being celebrated across the country. And in IPL cricket, Chennai Super Kings to take on Royal Challengers Bangalore this afternoon. Sunrisers Hyderabad to face Delhi Capitals in Chennai at 7:30 p.m. As the number of COVID cases is on the rise again, we appeal to our listeners not to lower their guard, take all precautions, and all those above 45 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi has said that in this period of corona crisis, everyone is getting aware of the importance of vaccine. He appealed to the people not to get swayed by any rumor about the vaccine. Sharing his thoughts in Mann Ki Baat program on All India Radio today, Mr. Modi said people above 45 years of age can benefit from the free vaccine that has been provided by the centre to all the state governments. He said from the 1st of May onwards, the vaccine is going to be made available for every person above 18 years in the country.
कोरोना की इस संकट काल में वैक्सीन की अहमियत सभी को पता चल रही है। इसलिए मेरा आग्रह है कि वैक्सीन को लेकर किसी भी अफवाह में न आए। आप सभी को मालूम भी होगा कि भारत सरकार की तरफ से सभी राज्य सरकारों को फ्री वैक्सीन भेजी गई है। अब देश का कॉरपोरेट सेक्टर, कंपनियां भी अपने कर्मचारियों को वैक्सीन लगाने के अभियान में भागीदारी निभा पाएगी। भारत सरकार की तरफ से मुफ्त वैक्सीन का जो कार्यक्रम अभी चल रहा है, वो आगे भी चलता रहेगा। मेरा राज्यों से भी आग्रह है कि वो भारत सरकार के इस मुफ्त वैक्सीन अभियान का लाभ अपने राज्य के ज्यादा से ज्यादा लोगों तक पहुंचाएं।
Mr. Modi also urged people to take vaccine, take precautions and stay safe. The Prime Minister said that we should not forget the mantra of Dawai Bhi, Kadai Bhi. He expressed hope that people will come out of this crisis soon. He said the Government of India is also fully engaged in taking forward the efforts of the state governments. Mr. Modi said state governments are also trying their best to fulfill their responsibilities.
मैं आप सभी से आग्रह करता हूं कि वैक्सीन हम सबको लगवाना है और पूरी सावधानी भी रखनी है। दवाई भी, कड़ाई भी, इस मंत्र को कभी भी नहीं भूलना है। हम जल्द ही साथ मिलकर इस आपदा से बाहर आएंगे।
He said in order to tide over this crisis, he had long deliberations with experts from different sectors. Mr. Modi said people from pharma industry, vaccine manufacturers, those connected with oxygen production, experts from the medical field have put forth their valuable suggestions to the government. The Prime Minister said this time, for emerging victorious in this battle against COVID-19, we have to accord priority to expert and scientific advice. In this edition of Mann Ki Baat, which focused on COVID-19 pandemic, Mr. Modi interacted with coronavirus. Interacted with Dr. Shashank Joshi from Mumbai, who said there is nothing to fear and we will overcome this wave of COVID-19.
एक नई एक्सपेरिमेंटल दवाई है जिसका नाम है रेमडेसिविर। ये दवाई से एक चीज जरूर होती है कि अस्पताल में 2-3 दिन कम रहना पड़ता है और क्लिनिकल रिकवरी में थोड़ी सी उसकी एड होती है। ये भी दवाई कम काम करती है जब पहले 9-10 दिन में दी जाती है और ये 5 ही दिन लेनी पड़ती है। तो ये लोग जो दौड़ रहे हैं रेमडेसिविर के पीछे, ये बिल्कुल दौड़ना नहीं चाहिए। ये दवाई की थोड़ा काम है, जिनको ऑक्सीजन लगता है, प्राणवायु ऑक्सीजन लगता है, जो अस्पताल में भर्ती होते हैं और डॉक्टर जब बताते तभी लेना चाहिए। तो ये बहुत जरूरी है सब लोगों को समझना। और कभी कभी ये दवाई यदि मिल जाती है तो योग्य लोगों में ही देनी चाहिए। तो इसके लिए बहुत भ्रम पैदा हुआ है और इसलिए ये स्पष्टीकरण देना चाहता हूं सर कि अपने पास वर्ल्ड की सबसे बेस्ट ट्रीटमेंट अवेलेबल है।
Mr. Modi interacted with Dr. Nawed Nazir Shah of Srinagar in Jammu and Kashmir, who said there is no need to panic this time too and people should adhere to the protective measures.
करीब करीब 90-95% से ज्यादा जो मरीज हैं वो खुद विदाउट एनी मेडिकेशन भी ठीक हो जाते हैं। तो वक्त जैसे गुजरता गया तो लोगों में जो कोरोना का एक डर था वो बहुत कम हो गया। सेकंड वेव जो आई है इस कोरोना में, इस टाइम भी हमें पैनिक होने की जरूरत नहीं है। इस मौके पे भी हम अगर जो प्रोटेक्टिव मेजर्स हैं, जो एसओपीज हैं, अगर उन पे हम अमल करेंगे, जैसे मास्क पहनना, हैंड सैनिटाइजर का यूज करना, इसके अलावा फिजिकल डिस्टेंस मेंटेन करना या सोशल गैदरिंग्स हम अवॉइड करें, तो हम अपना रोजमर्रा का काम भी बखूबी निभा सकते हैं और इस बीमारी से प्रोटेक्शन भी पा सकते हैं।
Mr. Modi spoke to Sister Surekha, Senior Nursing Officer in KC Jindal Hospital, Bengaluru, who said early testing and proper tracking help in reduce the mortality rate.
The early testing and proper tracking help us to reduce the mortality rate. If you find any symptoms, isolate yourself and consult nearby doctors and get treated as early as possible. So community need to know awareness about this disease and be positive, don't be panic. With my own experience, I wanted to tell the citizens of India, no vaccines provides 100% protections immediately. It takes time to build a immunity. Please don't be scared to get vaccinated. Vaccinate yourself. There is a minimal side effects.
The Prime Minister said our personnel from the medical field, frontline workers, are all endeavouring 24/7 in services. He said other people of the society also are not lagging behind at this time.
हमारे मेडिकल फील्ड के लोग, फ्रंटलाइन वर्कर्स, दिन रात सेवा कार्यों में लगे हैं। वैसे ही समाज के अन्य लोग भी इस समय पीछे नहीं है। देश एक बार फिर एकजुट होकर कोरोना के खिलाफ लड़ाई लड़ रहा है। कोई क्वारंटाइन में रह रहे परिवारों के लिए दवा पहुंचा रहा है, कोई सब्जियां, दूध, फल आदि पहुंचा रहा है, कोई एम्बुलेंस की मुफ्त सेवाएं मरीजों को दे रहा है। देश के अलग अलग कोने में इस चुनौतीपूर्ण समय में भी स्वयंसेवी संगठन आगे आकर दूसरों की मदद के लिए जो भी कर सकते हैं वो करने का प्रयास कर रहे हैं।
Mr. Modi said the country is once again united in fighting against corona. He said even in such challenging times in different corners of the country, voluntary organizations are coming forward and trying to do whatever they can to help others. Mr. Modi said hundreds and thousands of brothers and sisters from nursing staff are performing their duties exemplarily, and it is a big inspiration for everyone. He urged them to give special attention to their health as well and take care of their family. The Prime Minister spoke to ambulance driver Prem Verma, who emphasized that people should take the vaccine doses as it is good for them and also for their family.
जैसे ही कंट्रोल हमें एक टैब पे कॉल देता है, 102 से जो कॉल आती है, हम मूव करते हैं पेशेंट के पास। हम पेशेंट को जाते हैं उनके पास। तो 2 साल से हम कंटिन्यू कर रहे हैं काम। अपना किट पहन के, ग्लव्स, मास्क पहन के पेशेंट को जहां वो ड्रॉप करने के लिए कहते हैं, जो भी हॉस्पिटल में, हम जल्दी से जल्दी उनको ड्रॉप करते हैं। सभी को ये डोज लगवानी चाहिए। अब मुझे मेरी मम्मी कहती है ये नौकरी छोड़ दो। मैंने बोला मम्मी अगर मैं भी नौकरी छोड़ के बैठ जाऊंगा तो सब और पेशेंट को कैसे कौन छोड़ने जाएगा।
The Prime Minister said this time new awareness is also being seen in the villages, and by strictly following the COVID rules, people are protecting their villages from corona. He said this resolve gives us strength and confidence. He added that whatever efforts are being made are of great service to the society and they strengthen the power of society.
इस बार गांवों में भी नई जागरूकता देखी जा रही है। कोविड नियमों का सख्ती से पालन करते हुए लोग अपने गांव की कोरोना से रक्षा कर रहे हैं। जो लोग बाहर से आ रहे हैं उनके लिए सही व्यवस्थाएं भी बनाई जा रही हैं। शहरों में भी कई नौजवान सामने आए हैं जो अपने क्षेत्र में कोरोना के केस न बढ़े इसके लिए स्थानीय निवासियों के साथ मिलकर प्रयास कर रहे हैं। यानी एक तरफ देश दिन रात अस्पतालों, वेंटिलेटर्स और दवाइयों के लिए काम कर रहा है, तो दूसरी ओर देशवासी भी जी जान से कोरोना की चुनौती का मुकाबला कर रहे हैं।
The Prime Minister said today's Mann Ki Baat focused on the corona pandemic as the biggest priority is to defeat the disease. He added that positive spirit is imperative to fight corona and the countrymen have to maintain it.
कोरोना से लड़ने के लिए पॉजिटिव स्पिरिट बहुत ज्यादा जरूरी है और देशवासियों को इसे बनाए रखना। साथियों, डॉक्टर्स और नर्सिंग स्टाफ के साथ साथ इस समय लैब टेक्नीशियंस और एम्बुलेंस ड्राइवर्स जैसे फ्रंटलाइन वर्कर्स भी भगवान की तरह ही काम कर रहे हैं। जब कोई एम्बुलेंस किसी मरीज तक पहुंचती है तो उन्हें एम्बुलेंस ड्राइवर देवदूत जैसा ही लगता है। इन सब की सेवाओं के बारे में, इनके अनुभव के बारे में देश को जरूर जानना चाहिए।
The Prime Minister's Citizen Assistance and Relief in Emergency Situations PM CARES Fund has given in-principle approval for allocation of funds for installation of 551 dedicated pressure swing adsorption PSA medical oxygen generation plants inside public health facilities in the country. The decision is in line with Prime Minister Narendra Modi's direction of boosting availability of oxygen to hospitals. The Prime Minister has directed that these plants should be made functional as soon as possible. He said that these plants will serve as a major boost to oxygen availability at the district level. These dedicated plants will be established in identified government hospitals, in district headquarters in various states and union territories. The procurement will be done through Ministry of Health and Family Welfare. The PM CARES Fund had earlier this year allocated over 201 crore rupees for installation of additional 162 dedicated PSA medical oxygen generation plants inside public health facilities in the country. The basic aim behind establishing PSA oxygen generation plants at government hospitals in the district headquarters is to further strengthen the public health system and ensure that each of these hospitals has a captive oxygen generation facility. Such an in-house captive oxygen generation facility will address the day-to-day medical oxygen needs of these hospitals and the district. In addition, the liquid medical oxygen will serve as a top-up to the captive oxygen generation. Such a system will go a long way in ensuring that government hospitals in the districts do not face sudden disruption of oxygen supplies and have access to adequate uninterrupted oxygen supply to manage the COVID-19 patients and other patients needing such support. Home Minister Amit Shah has thanked Prime Minister Narendra Modi for allocating funds to install 551 PSA oxygen generation plants in public health facilities across the country through PM CARES. In a tweet, Mr. Shah said it is a big decision to curb the oxygen crisis and help the people in need.
The government has directed all major ports to waive off all charges for ships carrying oxygen and oxygen-related equipment cargo. The step has been taken in view of the excessive requirement of oxygen and related equipment in the country to effectively deal with COVID-19 pandemic. The Ministry of Ports, Shipping and Waterways has directed to accord highest priority in the berthing of such ships which are carrying consignments of medical-grade oxygen. The centre has substantially increased the allotment of antiviral drug remdesivir to all states. Maximum 4,35,000 vials have been allotted to Maharashtra, followed by 1,65,000 to Gujarat, 1,61,000 to UP and 1,22,000 to Karnataka. 72,000 vials have been allotted to Delhi, 75,000 to Chhattisgarh and 95,000 vials to Madhya Pradesh. This allocation is till the 30th of this month.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi urges people not to be swayed by rumours about COVID-19 vaccine. Asks them to not forget the mantra of Dawai Bhi Kadai Bhi. In his Mann Ki Baat program, Prime Minister appeals to states to extend benefit of centre's free vaccine campaign to maximum people. Government fully engaged in taking forward the efforts of state governments against COVID pandemic, says Prime Minister. Mr. Modi says positive spirit is imperative to fight corona and the countrymen have to maintain it. Prime Minister lauds the role of nurses, ambulance drivers and other corona warriors in serving the people. 551 oxygen generation plants to be set up in district government hospitals through PM CARES. Over 14 crore 9 lakh COVID-19 vaccine doses administered in the country so far. Delhi government extends lockdown till 3rd of May amid spike in COVID cases. Centre hikes allocation of remdesivir injections to states. Mahavir Jayanti being celebrated across the country, and in IPL cricket, Chennai Super Kings to take on Royal Challengers Bangalore this afternoon. Sunrisers Hyderabad to face Delhi Capitals in Chennai at 7:30 p.m. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the Midday News. India's vaccination drive against COVID-19 crossed another milestone today with administration of over 14 crore 9 lakh doses within 99 days of the world's largest vaccination program. The Health Ministry has informed that with more than 25 lakh 36,000 doses of COVID vaccine administered in the last 24 hours, India has become the fastest country to administer over 14 crore doses in a record time. The number of COVID vaccination centers in the country increased from nearly 45,000 to nearly 65,000, registering a growth of over 20,000 centers in a short span of time. Health Ministry has informed that so far more than 11 crore 85 lakh people in the country have received the first dose of COVID vaccine, whereas nearly 2 crore 22 lakh have been fully vaccinated with both the required doses. From the 1st of next month, which is also the third phase of the largest vaccination drive, everyone above the age of 18 years will be eligible to take COVID vaccines. The registration for the third phase will begin this Wednesday on the CoWIN platform and Arogya Setu app. The centre has advised states and union territories to register additional private COVID vaccination centres in mission mode for the third phase of vaccination, which will commence from the 1st of May. It has asked them to engage with private hospitals, hospitals of industrial establishments and industry associations. The states were also advised to coordinate with designated appropriate authority for applications and their processing and monitoring of pendency of registration.
Bharat Biotech has announced the cost of Covaxin for state governments and private hospitals. It will cost 600 rupees per dose for state governments and 1200 rupees per dose for private hospitals. The price of vaccine for export is $15 to $20. The number of total active cases of COVID-19 in the country further swelled up today to comprise nearly 15.82% of the total reported cases. The Health Ministry has informed that currently over 26,82,000 people are reported to be suffering from the viral pandemic and are either hospitalized or are under home isolation. In the last 24 hours, the nation registered nearly 3,49,000 new COVID cases. With this, the recovery rate has further slipped to stand at 83.05%. Since yesterday, over 2,17,000 people have been discharged from hospitals or are reported to have been completely cured. So far, over 1 crore 40 lakh people have recovered from COVID-19 infection in the country. The Health Ministry has informed that 2,767 COVID-related deaths were reported in the last 24 hours, taking the cumulative toll to 1,92,311.
In the Union Territory of Jammu and Kashmir, the J&K government is relentlessly trying to contain the surge in the positive cases of COVID-19 being reported nowadays. Announcements are being made to use face masks and adhere to other COVID SOPs in an effort to break the chain of the COVID virus. Presently, the entire Jammu and Kashmir is under Corona curfew, which began yesterday evening and will last till tomorrow morning. More from our Srinagar correspondent.
On the one hand, when government leaves no stone unturned in addressing and mitigating the issues and problems of its citizens, but on the other hand, onus lies with the people at large as well, since some people are still seen not adhering to COVID guidelines, thus risking the lives of many and showing the complacent attitude. Owing to this, people at large should rise to the occasion and assist the administration in breaking the chain of the deadly contagious COVID-19 infection. Sunil Kohl, AIR News, Srinagar.
The Delhi government has decided to extend the lockdown in the wake of rising cases in the national capital. Delhi Chief Minister Arvind Kejriwal today announced that the lockdown has been extended till 5 a.m. of the 3rd of May. During the lockdown, people engaged in essential services and facing emergency conditions will be allowed for movement on producing the valid documents. Earlier, a 6-day lockdown was imposed in the city to contain the spread of COVID-19 cases. Expressing concern over the rising cases of coronavirus in the city, Mr. Kejriwal said health facilities are witnessing shortage of oxygen. He said Delhi currently needs 700 tons per day and the union government has increased the quota of oxygen to 480 tons per day. He thanked the central government for providing necessary help in this crisis situation. He said Delhi government has started a portal which will be updated every 2 hours by oxygen manufacturers, suppliers and hospitals for better management of oxygen supply.
Chief Minister Shivraj Singh Chauhan has said that ensuring oxygen supply is a top priority of the state government in the management of COVID infection. Madhya Pradesh Chief Minister was addressing a virtual meeting of Corona Control Core Group regarding prevention and arrangements of COVID-19. More from our Bhopal correspondent.
Efforts are being made by state government on a war footing at all levels of production and transport of oxygen in the state. Chief Minister Shivraj Singh Chauhan informed that in a discussion with the Union Minister of Railways, Mr. Piyush Goyal, it has been decided that the Ministry of Railways will provide oxygen train to Bhopal. This train will reach Bhopal from Bokaro via Ranchi. The possibilities of making necessary arrangements for converting the nitrogen tankers for oxygen is also being worked out. Chief Minister also urged FICCI National Executive Committee to extend support in the availability of tankers, oxygen cylinders, ventilators and oxygen concentrators. Empty cylinders are being airlifted to reduce the transport time of oxygen supply. Pooja Pivardhan, AIR News, Bhopal.
In the wake of oxygen shortage for treating corona patients in Maharashtra, various local bodies in the state are coming up with their own oxygen production plants to cater to the rising demand. More from our correspondent.
In order to overcome the shortage of oxygen in the district, the Nandurbar District Collector Dr. Rajendra Bharut has set up 3 oxygen cylinder production projects which would cater to about 40 to 50% of the district's demand. Besides, 2 more projects to absorb oxygen from the air will also be set up in the next 8 days. Work on the liquid oxygen project is also in progress and it is believed that Nandurbar will be the first district in the state to become self-sufficient in oxygen production in the first 2 weeks of May. Similarly, the BMC is also planning to set up 16 projects in 12 hospitals which will provide a total of 43 metric tons of oxygen per day. BMC said the project will be completed within a month after the completion of the tender process. Devapriya Bhattacharjee, AIR News, Mumbai.
In the Union Territory of Puducherry, special efforts are being made for the counting of votes on coming Sunday in view of the sudden increase in the number of COVID-19 cases.
The Chief Election Officer Surbir Singh in a press note said that the Election Department in coordination with the Health Department extended the facility for RT-PCR testing for the willing contesting candidates or agents from the notified testing center. To tackle any medical emergencies, one dedicated medical team along with the ambulance per counting center would be made available. If any of the willing counting staffs, contesting candidates or counting agents wishes to wear PPE kit, provision for the same have been made at the counting center. The CEO further added that all the counting centers in Puducherry, Karaikal, Mahe and Yanam would be sanitized 1 day prior to the counting and after the process of counting is completed. And the biomedical waste generated at the counting centers would be collected and disposed of thrice on the counting day. Chandramohan, AIR News, Puducherry.
A senior officer of the Indian Information Service, Manikant Thakur, passed away following COVID-19 infection. He was admitted in the Safdarjung Hospital, Delhi. Mr. Thakur served in different departments of the Ministry of I&B, including the Bureau of Outreach and Communication, News Services Division of All India Radio and DD News. He was recently posted in the Health and Family Welfare Ministry as the Chief Media Officer. Free rides are being arranged for the voters aged above 80 years and those with disabilities to cast their vote in the West Bengal Assembly elections. The additional CEO, Sanjoy Basu, informed media persons that 17 persons in the 5th phase and 10 voters in the 6th phase elections use this free taxi service. Our correspondent reports on the service provided to select voters as the state gears up for the 7th phase of elections tomorrow.
There are 1,01,689 voters above the age of 80 and 50,919 voters with disabilities during the 7th phase of polling in 34 constituencies to be held tomorrow. The election office in the state has tied up with Uber taxi service provider to provide a free ride to the senior citizens and people with disability in select constituencies. A ride will be free for the 2 kilometers distance up to a fare of 200 rupees. Extra will have to be paid by the voters. To avail the service in 4 constituencies in Kolkata South, the qualified voter has to call up Election Helpline 1950 and receive the promo code. They have to add the promo code in Uber app wallet and book a ride to the polling booth. Sudhindra, AIR News, Kolkata.
The government has said harvesting of rabi crops is on schedule in the country and in 81.55% of wheat sown has already been harvested. State-wise harvesting has also increased and reached 99% in Rajasthan, 96% in Madhya Pradesh, 80% in Uttar Pradesh, 65% in Haryana and 60% in Punjab. Harvesting is at its peak in Haryana, Punjab and Uttar Pradesh and is likely to be completed by the end of this month. Of the pulses sown in over 158 lakh hectares, harvesting has been completed for gram, lentil, urad, moong and field pea. For sugarcane, out of the total sown in over 48 lakh hectares, harvesting has been completed in Chhattisgarh, Karnataka and Telangana. Mahavir Jayanti, the birth anniversary of 24th and last Jain Tirthankar Bhagwan Mahavir, is being celebrated across the country today. Mahavir Jayanti is considered to be one of the most auspicious events for Jain community and holds a lot of importance in their religious life. President Ramnath Kovind has extended heartfelt greetings to all countrymen, especially the Jain community on the occasion. Vice President M. Venkaiah Naidu extended greetings on the auspicious occasion of Mahavir Jayanti. Prime Minister Narendra Modi has also said that the life of Lord Mahavir teaches us peace and self-control. In IPL cricket, there will be 2 matches today. In the first match, Chennai Super Kings will be up against Royal Challengers Bangalore in Mumbai at 3:30 p.m. The second match will be played between Sunrisers Hyderabad and Delhi Capitals in Chennai at 7:30 p.m. Yesterday, the Rajasthan Royals defeated Kolkata Knight Riders by 6 wickets in Mumbai. Chasing a target of 134 runs, Rajasthan Royals reached 134 for 4 in 18.5 overs.
And now let us take a look at the weather forecast for today. National capital Delhi is witnessing mainly clear sky. Maximum temperature is expected to be nearly 36 degrees Celsius, while the minimum temperature was 18 degrees. Mumbai has partly cloudy sky with maximum temperature expected to be around 35 degrees Celsius. The minimum temperature was 25 degrees. Chennai also has partly cloudy sky. Upper level of temperature is expected to be around 37 degrees Celsius and the lower level was 28 degrees. Kolkata is experiencing partly cloudy sky. Maximum temperature is likely to be nearly 38 degrees Celsius after a maximum of 27 degrees. Jammu and Srinagar are witnessing mainly clear sky. In Jammu, the maximum temperature will be around 33 degrees Celsius, while in Srinagar, the upper level is expected to be around 23 degrees. Leh also has mainly clear sky, with temperatures rising from -3 to a maximum of 10 degrees Celsius. Gilgit has mainly clear sky with a maximum temperature of around 27 degrees Celsius. Muzaffarabad is also witnessing mainly clear sky. Maximum temperature may touch 29 degrees Celsius. Chandigarh will have mainly clear sky and may see temperature rising up to 35 degrees Celsius. Dehradun is also having mainly clear sky. Maximum temperature will be 33 degrees Celsius. Hyderabad, rain or thunder showers would occur towards evening. Maximum temperature will rise up to 38 degrees Celsius. Patna has partly cloudy sky with maximum temperature rising up to 40 degrees Celsius. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi urges people not to be swayed by rumors about COVID-19 vaccine, asks them to not forget the mantra of Dawai Bhi, Kadai Bhi. In his Mann Ki Baat program, Prime Minister appeals to states to extend benefit of centre's free vaccine campaign to maximum people. Government fully engaged in taking forward the efforts of state governments against COVID pandemic, says the Prime Minister. Mr. Modi says positive spirit is imperative to fight corona and the countrymen have to maintain it. Prime Minister lauds the role of nurses, ambulance drivers and other corona warriors in serving the people. 551 oxygen generation plants to be set up in district government hospitals through PM Cares. Over 14 crore 9 lakh COVID-19 vaccine doses administered in the country so far. Delhi government extends lockdown till the 3rd of May amid spike in COVID cases. Centre hikes allocation of remdesivir injections to states. Mahavir Jayanti being celebrated across the country. And in IPL cricket, Chennai Super Kings to take on Royal Challengers Bangalore this afternoon. Sunrisers Hyderabad to face Delhi Capitals in Chennai at 7:30 p.m. For details of these stories and more, log on to our website newsonair.com and News on AIR app. And with that, we end the Midday News.